Hi ladies, thank you so much for tuning in for my second video, Starting the Journey. So I am Samantha Jacobs, a licensed acupuncturist in Ridgefield, Connecticut. For over 15 years I've been specializing in fertility. And just to briefly catch you up from the first video, I've been on the internet searching, looking for information, keeping on top of what's going on in the industry. What's become apparent to me is that the internet is filled with a lot of garbage, a lot of conflicting information, and I thought as a practitioner I would love to give you an understanding of my experience and how I help my clients go through the process of what I call building the framework for a fertility house. Part of what I do in my practice is give clients as much good solid information as possible so that as they're making decisions going through the process that they can feel that they've made the best decisions possible. This first video is targeted to the client who's under the age of 34. She has generally been trying to conceive for 6 to 12 months without success. And she is now at the place where she's going to want to figure out what exactly is going on with her fertility. Generally, this client is going to start her fertility journey by going to an OB. So this is a sidebar. If you are a client over the age of 35, you'll want to skip to my video called The Involved Client. If you're over the age of 35, I just highly recommend that you skip the OB and you actually go to the RE, reproductive endocrinologist, at a fertility clinic. There comes a point where age does become a factor in Western medicine treatments, not in holistic care, not in my practice. I've had clients get pregnant at age 45. But if you're looking to utilize Western medicine, age is a factor. So over 35 should be going directly to a fertility clinic where you're going to get the most thorough care available to you. If you're the client under 34, you're going to probably start with your OB. Over all these years, I've had a lot of different experiences with clients going to their OB to get help. And I've learned a couple of things along the way that I educate my clients on. So I'm going to pass this on to you. There are 3 things that I see generally OBs leaving off their exams. There are 3 things that are really key players for your fertility knowledge. And when you go to your OB, request them. So the first thing you're going to ask for is blood work on day 3 of your cycle. In that day 3 blood work, you're going to want to have FSH and AMH measured. These are 2 key players in Western medicine. So I put my sidebar in holistic medicine, they're not key players. I've had lots of women conceive in my practice with abnormal FSH and AMH. They're not particularly an issue for holistic medicine. But if you're going to be utilizing Western medicine, yes, having this information is key, and it will help you figure out what kind of future decisions you would want to make if that blood work comes back abnormal. FSH is a hormone called follicle stimulating hormone. FSH job is to actually help the egg grow and mature, and then it's going to ovulate. When FSH comes back abnormal, it tells us that the eggs aren't so responsive to growing. FSH is considered abnormal when it's above 10. That tells us that the body is having to secrete more FSH to get the eggs in the ovary to respond to growing. The other hormone that is measured is AMH, anti-Mullerian hormone. Anti-Mullern hormone is responsible for the waking up of dormant follicles, sleepy follicles, waking them up in a group and helping them move forward to become the egg that's going to ovulate. AMH is considered normal between 1 and 4. If you come in with AMH below 1, that tells us that the body isn't stimulating those sleepy follicles as well. So there's not as many follicles being woken up in each cycle. These two hormones are key players in IVF. It gets harder and harder to conceive with IVF when you have these hormones out of balance. So depending on what you want and how you want to proceed in your fertility journey, having the information from these two hormones, key players. The second thing I ask clients to ask their OB for is a histiosonogram. So basically this is going to be an ultrasound that's going to look at the physical part of your uterus and your fallopian tubes. So it's to ensure there's no blocked tubes, there's no polyps in the uterus, there's no cysts, endometriosis, fibroids, that there's nothing physically impeding the egg coming down the tube or an embryo implanting into the uterus. The third thing I have clients ask their OB for is to rule out any endocrine issues. That would include thyroid, diabetes, polycystic ovarian syndrome, irregular ovulation, no ovulation. All of these endocrine issues should be ruled out so that we can fully understand what's going on with your health to help you make the best decisions. The other trend I've been noticing over the last couple of years is OBs getting involved with fertility treatments. I'm having clients come to me after seeing their OB being prescribed drugs like Clomid and Follistim for improving their ovulation, improving egg growth. If you are deciding to use your OB for a fertility treatment, please do ask them for monitoring. If you're not familiar with monitoring involves blood work and ultrasound. The blood work is looking at what's going on hormonally, and the ultrasound is looking at how many eggs are growing on the ovary, how the eggs are maturing, and when to time intercourse. If you are doing a fertility treatment with your OB and it does not involve monitoring, please be cautious of the following items. 1, being recommended that you use a over-the-counter monitoring kit. So monitoring kits are notorious for not being terribly accurate. And in fact, on my website, I put up a research article that found monitoring kits were not as accurate as just following cervical mucus. Some of the issues that occur around using a monitoring kit while you're on hormonal drugs, it changes your hormones. It can then thus change the results that the monitoring kit is giving you. And that means you may have mistimed intercourse. The second item would be making sure that you're not actually growing a cyst. One of the side effects of these drugs is producing a cyst on your ovary. Now you're gonna Google, don't Google, because you'll read all the horror stories. So in the 15 years I've been doing this practice, I've never had anybody have a bad experience with a cyst. Maybe they've had some pressure or some pain. The worst thing is that a cyst is not going to be a good egg. It's not an egg. So you're not going to get pregnant. And the other thing is that the cyst can actually hormonally shift you and make the next cycle, next month, unsuccessful in trying to ovulate. So that hormonal fluctuation from the cysts can really muck things up. Third, how many eggs exactly are you growing? Generally with younger clients, they respond really well to the drugs. They'll produce 2, 3, 4, 5. I've had 6 follicles. I've seen clients come in with many follicles. And if you're not having ultrasound monitoring, thus you have an increased chance of having multiples. 4, are you actually responding appropriately to the drugs that you are taking? Monitoring really gives you the best idea of how your body is responding to the drugs. And if you are a client who's taking these drugs and not responding appropriately, it's so crucial to have that information. Then that gives you more information to make another set of decisions. To give you an example, if you're on a high dose of Clomid and you're producing only 2 follicles where you really should be producing 6, that gives you information that your ovaries aren't as responsive to hormones as per se a normal client. Having that information may encourage you to actually switch up to go to an IVF clinic. It may want you to seek out alternative medicine. So having that information can be crucial about what are the next steps that you would want to take. Sidebar, know your insurance benefits. I encourage clients to call more than 2 times. I've had a client in the past who called 4 times and got 4 different quotes on their fertility benefits. Know your benefits, because when you're doing fertility treatments with an OB, it might be eating into your fertility benefits. Then if you decide to go to an IVF clinic, your benefits may be diminished. And then it can lead to all sorts of other problems that I've seen with clients, where you start to pay out of pocket for things that are tremendously expensive. Generally here in Connecticut, an IVF cycle runs between $12,000 and $15,000. Now, if you have a $10,000 benefit and you've done a couple of fertility treatments with your OB, suddenly that IVF cycle is going to be a lot of money out of pocket. So do be aware of how your benefits are being utilized so that you can make decisions about how you want to maximize that benefit. If there is nothing to diagnose, you will be given the diagnosis code of unexplained infertility, which is basically nothing. It just means there's no reason. From an alternative perspective, from a Chinese perspective, I see clients coming in and I can see lots of different things going on with them. So I can hormonally see that part, but from a Western perspective, that would not necessarily be noticed. And that would fall under the unexplained infertility. As you can see, having a diagnosis can be helpful. It gives you treatment options, and yet it may not be helpful at all. But that's the beginning point. It's the beginning point of exploring of what's going on and where is the next step in all of this. In the next video, I'm going to be talking to the client who's over 35, and we're going to be going through how do you make decisions and the process that you're facing. How is that going to look? And you'll see how different it is from this video and how much more there's more layers to it and more decision-making process. So that's the beginning point. I appreciate you listening. If you have any questions, any ideas, reach out to me, ladies. I would love to hear from you. And thank you once again for listening.